Well,
Yes.
I guess actually jumping into acupuncture and talking about maybe some of the science behind it, stuff like that. I guess overall, like, how does it actually work? Like,
Yeah, so I could explain it for this whole podcast, but trying to do the quick and dirty, more layman terms of
sure,
acupuncture. So, in some of these the words, the terminology is a little different, but we talk about chi, which is your energy, which it took me a long time to just accept like that word. But I mean, really, when we think about it, energy is everywhere. Everything is energy. Everything we do, everything's based off of energy, and that dates back to a lot of the old scientists that have
yeah,
been around, forever in physics and so on. So, we know everything's energy. Your body's energy. You have to eat to get energy. So, your body, if you're these young puppies that I walk past in the hallway, their energy is good, as you
right,
know. I mean, there's not a lot wrong with them. They feel good. They're happy. Everything's great. But as you get old, you get certain conditions, certain health conditions or mental conditions or what have you. I mean, there's a lot of things that go wrong. So then there's imbalances in your body. So, for
so
example,
your chi would be off.
your cheese off, your chi flow is off. So if you have, I use this example sometimes for my cancer patients. If I have the flu, my body's depleted. So then my back issues are worse. Everything
Mm,
hurts worse that
right,
bothered me before because my energy is going to heal me from that virus
right.
versus maintaining these other issues. So imbalance could be cancer. It could be, like Mia with her ambulatory or walking issues that she had, arthritis, whatever. So we restore kind of the balance. So um, there's meridians in your body, which are essentially these channels in your body. Acupuncture dates back 4,000 years ago. The ancient Chinese did not know all this when they were doing it. It's amazing that they figured this
Yeah,
out without
seriously.
all the I mean, there's over 30,000 peer-reviewed studies now
Wow.
indicating the efficacy of what we do, but they didn't have that. They were using stones to insert in acupoints, and, but they figured out these points, and a lot progressed over the years,
Is
but
that
they
what a meridian is? Just like a point to actually put a
it's
needle into?
essentially the channels. There's 12 main meridians that we talk about, and there's channels that are going through the body, and then there's different points on those channels. So we'll access certain points. So there's a point kind of on the shoulder on the bladder meridian that called the influential point for bone, bladder 11. I use that a lot because a lot of these patients have joint issues, bone issue, whatever. So I can help the knee if you have a knee issue by putting a needle up here on the shoulder and that point, and we'll usually utilize local points as well, but, so there's a lot of points that have specific functions, so we really try to use the least amount of points possible, so we're not, bothering the pet more than we have to, also, just because it's actually better, you get better results, so if this point does double duty, it helps the knee and the pet's been nauseous or doesn't have a good appetite, and it can do both things, then I'm gonna hit that 1 point versus
Right.
2 points somewhere
Yeah, that
else.
makes sense.
Yeah.
Wow. Okay, so kind of recapping that. So like we've dogs have chi, so overall just their energy. If something's off because they're sick, they have a disease, cancer, something like that, there's an imbalance. And then the meridians are the channels, and then there's points that are on the channels, the meridians, that you would then plug a needle into that would then kind of cause everything to kind of level out, so to speak, basically.
Yeah, essentially, we're irritating a point by sticking a needle in it. Well, there's multiple forms of acupuncture. Most people think of the needles. There's some
Right.
other forms that we utilize, but
That's kind of what you do
essentially
though, right?
irritate.
Needles.
Well, yeah, and then the aqua acupuncture where we're using the B12 and saline to
Right.
inject points. Electro where we hook them up to the machine, so we will stimulate down a meridian, and actually stimulate an important point more effectively by sending the electrical stimulation through it. So we get a stronger response, can help with
Right.
mesenchymal stem cell release and so on through that. Pneumoacupuncture will inject air into areas in some cases. Mia wasn't a candidate for that. Laser acupuncture, we stimulate points with lasers, and acupressure, where you're actually using pressure on acupoints, the least effective mode of stimulation, but something owners can do at home on a few select points. We'll instruct them sometimes for that as
Would that
well.
be like a massage kind of?
Yeah, massage indirectly, you're gonna hit a lot of acupoints, but specifically, I think we talked about this with Mia on her hind feet. There's a point kind of at the base of the paw pad that helps
Yeah.
with that proprioception in their hind feet. So that's a common one I
Gotcha.
recommend for owners as well.
So kind of recapping that. So there's a bunch of different kinds. So you've got regular needles, electro needles, hydro needles, air something, putting air under the skin, I think.
Yes.
Laser. acupuncture, and then acupressure, basically. Those
Yes,
are kinda like the main
and
ones.
hemo acupuncture, where we'll inject
Hemo?
their blood sometimes.
Yeah, I was thinking when it said hemo, I figured that's what that meant. Okay.
Yeah, so there's so many forms. We usually do the direct needling with the needles, then we do
Electro
some
and hydro.
electro, and then the aqua
Right.
acupuncture as well.
Because your laser thing that you do, and I think I have a question about this on here somewhere, but it is you are you doing laser acupuncture, or is that a different kind of laser?
So, essentially, generally speaking, we are just
You're using a red
specifically.
laser.
Yeah, so it's a red light laser, so it's red and infrared light that's basically helping with cellular energy, helping heal the cells internally
Right.
from the mitochondria, so, helps to just relieve pain, inflammation, and cellular regeneration, essentially. So, the what we did on Mia and what I do on most patients, I have, like, a laser point, like a actual, accessory that focuses directly on the point, but a lot of times I'm just lasering over regions that I think might be irritated or inflamed. So,
Gotcha.
but you can directly laser over an acupoint with a specific aperture.
Interesting. Okay.
Yeah.
Feel free to jump in, by the way.
I am just fascinated
Okay.
because,
Oh,
I was about to say I'm just hogging the conversation,
well,
so feel free to
you
jump in whenever you want to.
absolutely, but no, I'm just fascinated because I would never I would never have thought until knowing about Mia that you'd do acupuncture on dogs.
Yeah.
I've only ever heard of it for humans.
and
Yeah.
that's so common to
Yeah,
hear. People are always very surprised when I meet a stranger
yeah,
and they ask what I do for a living. Most of the time it is, I had no idea that was an option.
Yeah.
So,
yeah,
yeah, so it's great to spread awareness. I'm thankful to be able to do that. Yeah.
absolutely.
Well,
'Cause
oh, go ahead.
I was just gonna say, because like Mabel, when she got older and had the arthritis, the only thing I'd heard of doing was giving her supplements,
Right.
but painkillers and supplements.
And then there's that new drug too, and I don't was it you that said
Oh,
they didn't like it?
Librella.
Yeah, was it you that said it was like, "Don't do that"? 'Cause it
I'm not
I
I
think
mean,
you told me also
in
because Mia didn't have
certain
it.
just because Mia had some deficits, some proprioception deficits in her hind end, the spinal component, I personally am a little weary of using that when they have, potential spinal involvement with their
Right.
condition. And there's different approaches to Librella. I'm not saying I'm right and someone else is wrong, but Librella does have an indication in certain patients, but I do feel there are a lot of alternatives, like herbal therapies, acupuncture, laser
That would
therapy, and
also make
so
sense though,
on
because
that.
you're more holistic,
Yeah, so of
versus
course I'm steering more
yeah,
towards, I believe in Western medicine, we integrate that into our practice a lot, but if we can find a more natural approach
Mhm.
without the side effects, I'm eager to try that first if the client is,
Yeah,
amenable to that. And some people don't have the time for it, and that's fine, and then we'll kick over to another option, but a lot of
yeah,
people are really looking for that natural option.
yeah.
mhm.
Well, I'm on team Melanie, so,
Thank you.
okay, well, I guess you might have answered this earlier, and I guess I'll kind of ask the question, then kind of repeat back what you had said, but what kind of dogs benefit the most from what you do? And you had kinda already mentioned, like, when I'd asked earlier, like, "What's your main patient?" You said arthritis, cancer, kinda just old age overall, things like that.